Welcome. On behalf of Heartcrafted Foundation, I invite you again to another episode of COVID Cares. This is a series of webinars which we are doing with people who have done extraordinary work during the COVID times and the lockdown period. We all know that when the Janta curfew happened on 23rd and actually the country went into complete lockdown 25th of March, all of us were very worried. All of us were very panicky. Most of us, people like you and me, thought about our food, about our supplies, healthcare, emergency, distant relatives who are far away, what will happen to them. But there is a large segment of the society which we are not conscious for, possibly at that point of time, whose challenges were very much different. They were not having cash. They started losing their jobs. They were not having food. They were struggling to get health care. Many of them did not have a place to live. And we have seen thousands and thousands of them started walking on the roads of India, trying to go home, which at times hundreds or thousands of kilometers away. We also know that now we know that there are an equal number of people who did not move out of their homes, but got stuck with similar problems or same problems. We got aware about it after some time. Many of us started supporting in whatever way we can. There had been instances of maybe thousands, maybe lakhs of Indians who had gone out of their way to help out people so that they can survive during this time. We have been talking to those people during this series to bring out those stories which we may be missing. Today, we are talking to one person who is working with the underprivileged for a long time. I'll come back to his profile. But here is one individual who was not woken up to a situation just because there is a lockdown. He is acutely aware of the challenges that is facing our country and who got active as soon as the lockdown happened. Let me introduce Mr. Sarat Chandra Das. But before I go into his profile, let me spend a minute to talk about the Heartcrafted Foundation. This is a foundation which focuses on working with underprivileged women in giving them a sustainable livelihood. It intervenes in multiple levels, at times the supply chain, at times for skill building, getting market access, getting working capital. The idea is for a control group to have a higher level of income through a sustained intervention, which may at times happen for a couple of years or more than that. Let me come back to Mr. Das and give a brief profile of his. Mr. Sarat Chandra Das is a graduate from agricultural science, graduate in agricultural science from Assam Government University, and holds a postgraduate diploma in rural development and a certified expert in microfinance from the Frankfurt School of Finance and Management. He is also an MBA from Indian Institute of Business Management. He worked with Rashtriya Gramin Vikas Nidhi, Guwahati, Sadhan, where he holds a board position, New Delhi, and also HDFC Bank in the Agri and Microfinance section, till he joined Grameen Sahara as a CEO. Mr. Das has a strong grassroots understanding as well as managerial experience, including international exposure. At present, he is serving as the governing board member of DIA Foundation, Center for Microfinance and Livelihood, Grameen Development and Finance Private, Grameen Silk Producers Company Limited, and Arpan Trust. Mr. Das also worked as a consultant for the World Bank project with MART, New Delhi, and been on the board of SESTA and also Organization for Rural Improvement. Grameen Sahara is a NGO which is based out of a place called Shaigao, which is around 37 kilometers from Guwahati, part of the Kamrup district. And also some of the other organizations, primarily the producer organization, which I mentioned, is also based out of the same place. Needless to say, we all know Northeast, in spite of its huge potential, has not really developed as many of us expected. And whatever development has happened has remained restricted to places which are urban, like Guwahati. If you move out of the city of Guwahati, you will find a significant amount of underprivileged people. Shaigao is not an exception. And of course, Mr. Das and his team works for a large space around Shaigao. Today, we'll specifically hear from Mr. Das about the work that they have done during the COVID times to help underprivileged individuals. Mr. Das, let me come back to you. When this COVID happened, as we mentioned, all of us were very worried, very concerned. You know, you are one of the people who are working with these underprivileged for many years. You obviously understood the pulse of the situation much faster. But nevertheless, I'm sure the challenges which you faced, the cash flow, the loss of business, the loss of production, the fear, the panic, the healthcare challenges, not only for the employees who are working with you, but also the people who are your beneficiaries and also the people around who may not be directly a beneficiary, but given the fact that you are running organizations which are focused on the social sector, you are some way morally obligated to support them. And I'm sure you did a lot of good support. But tell me what went through your mind when the Janta curfew happened, or rather when the actual lockdown happened? How did you react to start with?
Okay. Good evening, and let me first thank you for inviting me to this conversation on COVID care. See, the moment this lockdown was imposed by the government because of that situation, as you know, we have already been, we have been working in the rural development sector for last 20 years, almost 20 years. So we have, I would say, have a large family. I mean, we have been working with close to 60,000 families through different project interventions, and we have also have around 250 people that are working in different institutions. Of Grameen Sahara Social Enterprise Group. And the moment actually it was, lockdown was declared or the lockdown was imposed. So, initially, like most of the other people, we also had to be within the four walls of the house. So it was not possible to go out from house. So, but it really actually, since we know that we understand that in the field level, the people that we are working with, there are a lot of families which are really vulnerable. I mean, they are just earning, and somehow they are sustaining their livelihoods. So it actually really the moment I started thinking that if this lockdown continues for a long time, I mean more days, then how these people will be able to manage, and how would be able to manage their food items or other requirements that they need for day-to-day sustaining. So that is why I think not more than 10 days or 12 days I was within home. Then immediately I started moving. I mean, I just wanted to see what is happening, in the ground, or how the families are actually, managing, how they are, collecting their food items, or how they are being able to manage their families. So that way, I just started, with my team, I started traveling to the villages. And in that, of course, it was also helpful that since I am also associated with Indian Red Cross Society. So, movement was not a problem for me. So that is why I could very openly, travel to the villages. And we saw that, yes, really, and of course, this time I saw that we also saw many families which, we are not working with, but they are economically so distressed. Really, I mean, we are surprised to know that even within our area of operation itself, there are so many poor families, so many distressed families. So then I thought, no, immediately we have to do something for these people. At least, first we have to save our lives. I mean, the food materials we have to have. So that is why immediately we started mobilize some resources. Some resources means like, Azim Premji Foundation. Then we have also at that moment of time only, there was a coalition. We call it as, Rapid COVID Response Coalition. It is a all India coalition. So we also approach them for some resources so that we can mobilize some, relief materials for these people. So accordingly, we could mobilize some resources, and we are very thankful to Azim Premji Foundation for their generous support for giving us funding support to provide relief materials to different people. And accordingly, in Meghalaya and in Assam, we could provide relief materials to many families, those who were actually in need. And at that point of time, because they did not have, and it was actually a sudden kind of thing. This imposition was all of a sudden. It was only at 20th, and it was from 23rd of March. So that way, people actually did not have much time to prepare for a long time of this lockdown. So that is why, this stage we saw, and we started distributing relief materials. And we could raise many families, I mean, in the villages which were in need of relief materials, which also, as per COVID protocol, because government, it was a very kind of, aggressively government also started giving the suggestions, the protocols. So accordingly, for that also we needed what we call sanitizers, we needed masks. So all those kind of things we needed. But initially, since food was more crucial at that point of time, so we started giving food materials. And in that, of course, I have to take the name of Here Social Enterprise, which is promoted by Jonali Shoikia. Then she also helped us in providing, because we are also working with a lot of weavers, and they are basically for women, and there are many families which are headed by the women, and they actually were earning something from weaving activities, but because of this sudden lockdown, they were also not in a position to weave or produce their products. And even if somebody were at home doing something, but there was no market, since market was completely closed. So that in that case, we thank here social enterprise groups for providing support to us to give some relief materials, some even in case also to support these women. So that way we started working with those people. Then, as I said, Coca-Cola India also supported us. Then Azim Premji Foundation also supported us. So it actually came to our mind that since we have been working and we understand the ground reality of the people, their income level, their problems, their case inflow, all those things we more or less understood over a period of time when we have been being engaged with them for so many years. So that way it came to our mind, and immediately we started working. And since then, of course, till the other date, I would say that till the month of last month, actually, we have been working in this space for providing support to the needy families.
So this is, you gave a very large number, 65,000 families you mentioned, right? Is it 65,000?
We are working with 60,000 families, but it was not possible for us to provide relief to all those families.
Yeah,
I think So we have provided relief material. I think around 8 to 10,000 families we were able to provide support, and it was also not possible for us to move to other states actually, because that time there was interstate travel restrictions. So in Meghalaya, only in the border areas of Kamrup district, one district, because the deputy collector actually he took initiative so that we can send our relief materials to that district. So that way actually we could reach Meghalaya, but not in Nagaland or not to Mizoram or other places. Even within Assam also we could not move to other districts. So that was a problem for us. But actually if we could have traveled to other districts, most probably we could have also mobilized some resources for the people that needed service at that point of time in those districts. Please, Dipankar.
So, when you are talking of support, I assume that people would have mostly, Coca-Cola or Azim Premji has been cash. Now you gave, you may not have given food, but you must have given food, cereals,
Ration.
pulses, ration. So
Yeah, ration. I was saying that.
how did you get that? Because all the shops are also, I mean, you of course run that unit also. I know that you also have a, sort of grocery entity, but 10,000 people for, so did you procure it from some large players or government, or how did it happen? I mean,
Actually, for that, we had to seek permission from the district administration. And of course, I have to mention here that during that time, this COVID period, we really were very thankful to the district administration and also the local administration, because, whenever we needed support, so they actually extended us a support. Like, since we had to, as you are rightly asking, that we had to procure this, grocery items, this materials, so it was not possible to get it locally here at Soigao, so we had to procure it from Guwahati. So in that case, actually we had to obtain permission from the district administration, and we could easily, procure those things from Guwahati. It was not possible from a local place.
okay.
So from district administration, actually we had to seek permission, and we got the permission for
that. You said, you are there for so many years, you're working always on the field, but for you also at times it was surprising that, how people are struggling, right? I mean, for survival. So, one is, of course, they got support from, people like you, maybe at some time government also, came in, but you also have quite a number of these people, as you said, that, they are working with your organizations, right? So
that.
did
Right.
you start some way the operations after the restrictions are little relaxed? I mean, now, of course, lockdown is 5 months behind us. So after 1-2 months, did you start something in terms of operations with restrictions and, of course, safety and all of that?
Yes. Actually, see, initially March it was from 23rd. So April, May, this complete 2 months. Actually, this immediately this lockdown was declared. So we called back all the staff that please reach your home. And
Okay.
of course, we have also our own facilities in the branches where they stay. So
Okay.
the people who were living in, in Mizoram or in Nagaland, so we advise them to stay back, because, if they come back, so it may also be difficult for them to again go back. But at that point of time, those who were in a position to get back to their home, so we advise them to get back to their home. And those who are not in a position to, so we just advise them to stay back there itself. So till June, these people were either at home or either at branch, but there is no operation. And of course, immediately after this lockdown was declared, whatever protocol was, advised by the government. So we also had our own internal advisories to all our employees, so that, they use the mask, they use the sanitizer, they use, maintain the social distance and all other kind of support and advisories. Actually, we started giving right from the beginning, and only from June, the people have again gone back to the branches. And of course, that time also, there also internally we also developed some protocols, like, if they go to a group meeting, how they have to, maintain that, how they have to organize the meeting, how they have to maintain the distance, and what are the protocols. So all those things, actually internally we also we develop some kind of standards, some kind of protocols, and we advise them. And even after that also, 2 of my colleagues actually got infected by COVID.
Okay. But
So
I hope
yeah, 2 of them got infected by COVID, and they were in hospital for 14 days. But fortunately, luckily, they are back now. So they have again joined back at home. And also, like, as I said, all the branches, we made it mandatory that every week at least twice they have to sanitize the house. I mean offices, they have to sanitize all their equipment they actually normally used to touch when they work. So all those protocols we also internally developed, and we actually took care as far as possible. And wherever there is not, without any field visit or without any physical contact to anyone, so we just stop them going to the field. And accordingly, fortunately, out of 250 people, so 2% have, unfortunately, I mean, I think also that is also not infected in our office hour or in our office activities, but somehow during their marketing or during their visit to some other places, they got infected. So in that way, I think we could take at least the required level of care for our employees. And of course, because of financial situation, for 2 months, we had to, of course, deduct 10-20% of salary for 2 months. But after that, we started giving. So now we are giving, we are not cutting any salary. And of course, at the head office level, I think around, I think 10 people still, senior people, they have voluntarily actually taking 10 to 20% salary cut of their own, voluntarily. We are not imposing anything, including me. Actually, I am also taking 25% salary cut as of now, and I have decided to continue it till the end of this financial year. But you know, field level people we have not touched. We have not. I mean, we have taken the care as far as possible. I mean, it's also not possible because we are not sitting in a single office. So although we have been giving regularly the protocols, giving them advisories, so it also depends on the people who are heading those branches. Right. So that way, but I think considering the number of cases that have been positive, so I think we could take enough care for our employees also, because 2% out of 200 people, so it is less than 1%.
Right, right. No, I know, and you know, especially when you have field staff, you know, they are always you know, on the road, and in any case, I think at some point or other, all of us will be affected by this, because I don't think there is any escape. So, you know, it is very good to hear that, you know, you sort of, you know, went for maybe a very minimal cut. You know, if I look at, you know, the numbers where people are saying 18 million have lost jobs, and everywhere, you know, the 30, 40, 50, 75, no salary, you know, I know organizations which has neither asked them to leave nor they are paying. They are saying you are on, you know, they are saying furlong, you know, 4 months, sit at home.
Right.
So that is something very commendable. But, you know, I am sure, you know, when this happened, you know, everybody's mind, you know, especially the people who are working, and more than that, the people who are not your staff, but, you know, working with you as weavers or producer company or, you know, any other way. The first fear of them is that, you know, what will happen to me, right? I mean, will Grameen Sahara be taking care of me, right? Because, you know, we all say employee first and all, but when rubber hits the road, many people are not really, you know, so how did you manage the communication? Because people are also so distributed for you. So did you do some call with them, or how did you manage, you know, or what sort of communication you gave?
Yeah, communication. See, now actually we have learned a lot of things. All those things are already available. Now today we are talking. We are in a Zoom call, but we could have done it long before.
Years, but we are suddenly we'll all learn.
Yeah. So now we are doing board meetings, so all Zoom call or Google Meet. In fact, I have recently joined 2 board meetings of Southern. You know, all, you know, people are sitting across the country, but we are meeting in Zoom call or in WebEx or maybe in Zoom. I mean Google Meet. So that way, actually, immediately after this lockdown was declared, we started chatting initially through this WhatsApp.
Mm-hmm.
So WhatsApp group we already had, but we normally did not use this you know, video calling and other thing. We only used to send message, get message. So we are using that. But immediately after this lockdown was there, so we had to sit idle only at the home. So we started creating groups. Like then we started having our video calling through this WhatsApp call. Then we immediately faced that no, there is a limitation in terms of numbers of people that can attend through WhatsApp call. So then we moved to Zoom. Then again we moved to WebEx. Then we have learned a lot of things, and during that period, mostly we have done all these communications through our video calling only. And in fact, when we send the people to the branches, then first thing there we ask the field staff to collect the mobile numbers of the people who are our beneficiaries. And we started calling them, we started giving them advices about how to take care from not to get infected from COVID and all. So then there was, I think, during the whole month of May and June, there was a continuous communication over telephone with the beneficiaries, and also for these employees we had different groups, and of course that has become a part of the system now. And every day today, because we have also some area demarcations, like one person look after this area, the other person looks after that area. So maybe under him there are 25 people, under him 20 people are there. So they have different groups. So they every day now after 5 o'clock, 5 to 6:30, they have to have video calling, and they have to also share the screenshot by 6:30 with me or my operation head or somebody who is a senior position. So they have to share that. So now it has actually become a part of our system now. And I think if we stop doing this, then we'll be we'll be realizing that we are actually not doing something else, something. So that is why it has now become a part of our system, and now we are much more common. More connected with the field people now. Earlier, once in a while we used to speak over telephone, and video calling hardly we used to be. But now, almost every day there is a connection, there is a contact between the head office and the branches with the area, or field team with the head office team. So that way actually, now I think this communication has got, I would say that much more strengthened than before. So yes, through video calling, through digital way only, we could create this entire communication system, and much better than before. And in fact, we have to give the credit for this to COVID.
Yeah. And I'm sure during this communication, you have been constantly saying that, I will, we, the organization, will take care of you, and we are together, and, so that people remain, confident, because confidence is a very, this is a time where a lot of people went into a lot of depression also.
Right.
Because of total uncertainty, plus sitting at home, plus, loss of income. So, I have, you mentioned quite a few of things, support from the government, very smooth, uh, approvals. You, of course, you said you are part of Red Cross, so you already had the access, but I'm sure others needed the permit and all. But do you have any instance where you really felt very moved, whether it is some it can be anything, somebody who you didn't expect supported, or somebody showed a lot of humanity, or a lot of honor, or some people who themselves are poor trying to help others. Do you have any
I can actually cite I can cite two examples. One was there in a tribal village. Actually, see, in a village we were also not having that much of capacity to support all the families in a village. So we had to be selective. In a village, if there are 50 families or 100 families, we used to identify the poorest ones and the people and the families which were in need of, in more need than the others. So that way we had to be selective. In that case, in one village, actually we saw a very exciting example, like when we went to that village, and we told them that we can give ration only to 40 families, and in that one person who was taking lead, and he was actually preparing the list. The family's name, that family is poor, this family is poor, they needed this thing, that thing. So finally, he was preparing the list, and I know that person. He was a young guy, but he is very, very poor. He was also not lesser need than the others. But finally, what he did, he prepared the list of 40 families and leaving his name.
And
I
he did
mean,
not
in
include
that,
his name.
he did not include his name. So, but later on, what I did, I actually came back and I sent a packet to him also later on. But I think it was an example. I mean, he was,
Amazing.
yeah. So he was,
No, it's
considering the
amazing.
need
You
of
know,
others.
it's not easy when your family is hungry and, see, we all
Yes,
talk of
yes, yes.
moral and ethics when we are sitting cushy with our thing, but
Yeah.
when the reality is there. So yeah,
Yes. So
fantastic.
that
Good
is
to hear.
one example. I think that is something that would excited me that yes, humanity is there. Then yes, there are people who thinks more for others than their own needs. So that is one
Absolutely.
example. And other example is one family was there. One girl actually, and her father has been suffering for a very deadly disease, and during that time, she was not in a position to go to Guwahati, and medicines were available only in Guwahati. It was not available locally. And during that time, it was not possible to move from this place to Guwahati, and because no vehicle, nobody was allowed to go to cities. So that time, I was personally called that this is my situation. If something is not done, so then my father will actually be in trouble. I mean, very soon, by tomorrow, if I do not get these medicines. So then, because as I said, no, it was easy for me to travel because, I had that, Indian Red Cross Society membership. I mean, executive member, I'm in the district. So I could easily travel to Guwahati. I went to Guwahati only for that purpose, to bring medicine. And when I came back and I gave the medicine, and, that she thanked me in such a manner. I mean, I was very, very, excited that yes, and of course, that time itself, I also realized that yes, there could be many people like her or like him that who are actually in need, but we are not in a position to identify those people who were in need and whom, because I cannot just go. I was not in a position to go to every household or every place to see or ask who are in need of such kind of medicines and other things. So there also, I think that was, of course, it was for me. It was a moment of happiness for me. So, but the previous example was a little bit different. But this is, it was, for excitement for me. So this is, I think, yeah,
I
there are
am.
some other instances, but yes, these two were, one is happiness for me, and the other point was, how people think for others also. So that is what I'd like to say.
So who knows that, father might have even, it could
Yeah,
have
yeah,
even
yeah, yeah.
become fatal, when you are not having some, and it's a very smart on her part and courageous on her part to even call you, to get your number and, make the
Yes,
request. I mean,
yes, right, right,
uh, so it is always,
right.
I think one of the things we are hearing, in all the cases that, uh, of course, so many people have helped people who can help people, as you mentioned, people who are themselves poor are trying to help or, letting go of their thing. But one of the good things which I'm consistently hearing and you're also repeating is the support of the administration. I think that is one dimension which has opened
Yeah,
up to a lot of us, like the likes of healthcare workers, police, for example. Police is something we are very negative, right? But the way they control this whole country, 130 crore people
right.
is this, and
Mm,
sometimes at 18 hours, 24 hours, 36-hour duty on the road. So this is, and also many others, the people who are not on leave, right? Even the people who are on telecom, the media, they have not taken leave, right? They have taken risk their life for us. So that way, I think, the whole COVID has shown a lot of good things. And if we can keep some of this with us, and I'm very confident it will stay with many of us, we'll
right, of
become
course.
much better people and much better society. So, thank you. Thanks so much, for your time. And it's always inspiring to hear you. Uh, and you are obviously very forward looking, even in terms of as you mentioned that, you have all the friendly, employee friendly infrastructure which you already had, and you already, you also took this early initiative of ensuring that they are not panicked. You came back to full salary for most of the people, especially the people who get paid less, right? Very quickly, which is, I think, is a fantastic thing, because so many people can face, medical emergencies, and also reached out
Right.
to people who are not just your direct beneficiary, but indirectly, right? So that's great, not just for you and me, but for the country as a whole, right? So many good people actually make the country good. So thank you so much, and see you soon.
Okay.
Whenever we are traveling, either way, we'll meet again.
Yes, 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 yes.
Stay
Please,
safe.
please
Take
come,
care.
and we are also. Thank you so much. Thank you so much for
Most
calling
welcome.
me and giving me the opportunity to interact with you. Thank you so much.
Thank you. Take care. Stay safe. Bye. Good night.